Well, good morning, everybody, and welcome to the Omni Hypnosis Training Center for our morning class on diabetes. And this afternoon we'll be doing another one on the coma state. So it's going to be an exciting day. I'm glad to see all of you here. I see some wonderful faces from our past. Some of our ex-students are here, and some brand new faces, which it's always great to meet new people. That's how we move our profession forward, by getting new folks involved. I'm glad to see some licensed professionals in the class today, and I'm sure from a medical point of view they know quite a bit more about diabetes than I do, which leads me to a very important point. For those of us that are not licensed as doctors, well, as medical doctors, working with diabetes, which is a medical problem, before you do that, you must, and I don't care whether you're living here in Florida or whether some of you folks out there are in Cleveland or Los Angeles, you must be working under a referral from a licensed doctor. This is a medical problem. And we need to have the diagnosis, we need to have the direction, we need to have the supervision. We're not to do this just on our own whims in our office. Well, we'll do it in our offices, but we need to have the medical supervision. You need a written referral from a physician to do the work. This is very important, and I want to put heavy emphasis on that, as I do for those of you who have been my students on all of the subjects that we teach, whether they're medical or psychological. If they're covered by medical doctors or psychologists, psychiatrists, we need the referrals to do that. It's not hard to get a referral if you're good at what you do, and just make sure you have one. That being said, while I was preparing for this class for diabetes, especially last night, I was talking to the group earlier before the camera went on. I became rather close with my family physician up here, and we were researching the literature on diabetes. And there's more information out there than anybody could possibly absorb. But the hypnosis information about diabetes is so far so minimal. It just doesn't seem anybody has been focusing on the non-medical intervention for the disease. And I was kind of shocked about that. Now, maybe there's literature that I've been unable to discover. I'm sure maybe something was written up in JAMA, or my favorite, the New England Journal of Medicine. But just to go grab a book off the shelf, one of our medical hypnosis books that we have an awful lot of in the office here as resource material, diabetes is ignored like the Black Plague. There's just nothing been there, which is kind of interesting to me, because I have been working with diabetics for years, and I just have assumed everybody else has been also working with diabetics for years. But it just doesn't seem to be the case. Kind of a vast wasteland of knowledge out there in the non-medical intervention approach to the problem. So that's why I'm so excited about this class today, because maybe it'll give us a new side on things, or a new way to look at things that we haven't considered before. So we talk about diabetes. Now, you medical folks in here know what diabetes is. Those of you with diabetes have a fairly good handle on what it is. But maybe there's people out there that in the room, or certainly out there in the world, who might see this tape, who are really not awful sure about what diabetes is. So let's just kind of cover that lightly. Basically, it's a disease in which the body doesn't produce insulin, or doesn't produce enough insulin. What is insulin? Well, insulin is a hormone needed to break down sugar and starches into energy. And when you're a diabetic, you just don't have enough of that to have that process completed to enough of a degree. All of the literature that I've seen simply says that the cause of diabetes is frankly a mystery to the caregivers out there. What we do is control the disease, but truthfully, we don't really know what causes diabetes. It's kind of a mystery. It's an extremely dangerous disease. It It's a disease maybe we don't think about. It's a disease that some people maybe have to take an injection for, other people pills or medication, and we don't think much about it being a deadly or a serious disease unless you're involved in it. Now, when you're involved in it, you realize what it can do. First of all, there's over 15.7 million people just in the United States that have diabetes. That's a whole bunch of people. And what's really more dramatic, probably 5.5 million, this is according to the American Diabetes Association, over 5.5 million individuals have the disease and are unaware they have the disease. This is really, once it's diagnosed and it's being medically controlled, that's one thing, but running around and not knowing you have it is a whole nother bag of worms. It can get really serious. It's the 6th leading cause of death. So we're talking a very serious problem here. And the medical literature simply says they have no cure, period. It is a killer of a disease. But it's a silent killer. It's not noisy. You don't hear people screaming and yelling and panic and agony and all these things. It's a silent killer. And it does it through indirect methods. First of all, it can cause blindness within individuals. Cover your eyes up for a moment and imagine what it would be like to go through life that way after you've been a seeing person. Imagine the terror that it would have to take to adapt to a life of being blind. Especially if, like me, you just bought a big screen TV. It causes kidney disease, can cause kidney failure. That's going to kill you. Most people don't realize it also causes nerve disease and is one of your leading causes of amputations. Most people are aware of diabetes also increases your risk of heart disease and stroke. And then there's my personal favorite. Diabetics frequently have problems with impotence. And there's probably a whole slew of other things that it causes. But I think those are sufficient to point out that we're dealing with a problem here that's enormous. We're dealing with a problem that's deadly. And can cause us serious illness, serious problems. Let's talk about the types of diabetes just for a couple of minutes. Basically, and I'm sure that the doctors in the audience can go ahead and say, well, there's a whole bunch of different ones and all these other things, but just as general categories. We have the type 1. Type 1 is they call it an autoimmune disease in which the body does not produce insulin. Most likely happens in the young and the old. Type 2, they say, is a metabolic disorder resulting from the body's inability to make enough or properly use insulin. 90 to 95% of diabetes is this kind. And then the other fairly large one is called gestational diabetes. This happens with pregnant women. Generally comes in about halfway through the pregnancy. And this puts a lot of extra fat into the child inside the woman, and they suffer from what they call fat baby syndrome. And that is, these women have rather chubby children in excess of 9 pounds, sometimes a lot more excess of 9 pounds. And these women who have this during pregnancy, it generally goes away when they're not pregnant, but they are candidates for diabetes to a much higher degree than other people after that. There's other type of diabetes that are associated with genetic syndrome, surgery, drugs, malnutrition, infections, and other illnesses, just kind of a bucket that you throw the rest of it into that we're not really that interested in at our level of knowledge. When I say our level, I'm talking about non-licensed hypnotists. I'm sure you physicians are much more interested in that. We talk about who's at a risk for diabetes. Who are the people that are the ones who may get diabetes? Now there's the medical philosophy on this, and then there is the mental philosophy. At this point of the class, we're going to talk just about the medical concept of this. They say people over 45, and you're going to see a very broad definition here. People generally over 45, people with a family history of the disease, people who are overweight, people who don't exercise, people who have low HDL or high triglycerides. Now this one really kind of blows my mind. I can't figure this one out though when I was reading it off of the American Diabetes literature. Certain ethnic or racial groups, and they say African Americans, Hispanic Americans, Asian and Pacific Islanders, and Native Americans. Well, who else is there? You know, it's like, why don't we just say everybody can be at risk of this disease? It's kind of silly how they broke that one down. Also, and this is what I found very interesting, during puberty, we're talking about children getting the disease. They say girls get it, will have a propensity if they're going to get it between the ages of 10 and 12, and boys between 12 and 14. Well, if we look at the way girls and boys mature at those young ages, it's pretty much at about the same instant, maturity-wise, that both of these two people are getting it. And isn't that an interesting time? Think about that. What time, what part of a child's life is this? This is called disaster time. This is where we discover, well, we don't discover, but we really start to become extremely interested in the opposite sex. Our hormones are pounding, and for those of us who are in the hypnosis or a field or have studied hypnosis to any degree, know that we are critically sensitive to waking hypnotic suggestion at this particular time. Very interesting thing when you start looking at the potential mental causes of the problem that we're dealing with here. And also the next one is women who have had gestational diabetes. They're at greater risk also. Oh, that was for type 1. Type 2, everything that I just told you plus. They amplify in it and they say African Americans are going to get it 1.7 times than others, Hispanic Americans and Native Americans. It's the same thing they said on type 1 for type 2. Warning signals. What are the warning signals of diabetes? Well, you diabetics know what it is. I'm a diabetic. Well, was. I don't know if I am anymore. Warning signals. Frequent urination. Unusual thirst. I remember this. I was teaching when I first realized, I didn't realize I had it. I was teaching a class in Fort Lauderdale. And I was so thirsty. I was drinking all the time. And urinating like there's no, just drinking, I could have stood by the toilet and just drink and urinate at the same time, it seemed like, you see. And then when I got to bed at night, when I finally went to sleep, I had to get up and get something to drink. Well, the only thing we had in the refrigerator in the hotel was a half gallon of orange juice. That was wonderful for my particular problem, and it just made me urinate more, and it was amazing. It's a wonderful wonder I didn't get myself in a coma or something at that point. And when I finally came home, that was down in Fort Lauderdale, I finally got home and I had to bring my mother in for her, she was alive then, for a checkup. And I went to my physician's office and I said, Andy, I says, there's something strange going on with me. He said, what's the matter? I told him. He says, well, let's give you a blood test. So he gave me the blood test and it was 375 or something like that. And he says, well, he says, you have adult onset diabetes and I'm going to medicate you so it's not going to be a problem for you. And I said, okay. That was before I had the chance to think about my own capabilities, what I might be able to do with it, which I was unsure of at that time for myself. But anyway, so they started me on the drug, as some of you people have also in the class. Some of the other things you have are extreme hunger. I don't remember that. Unusual weight loss. I would have welcomed that. Didn't have it. Extreme fatigue. I remember I was tired a lot. Maybe some of you were tired a lot. and irritability. And I remember I was a little snappy during that period. That's, and frequent infections. I didn't have that, but blurred vision can happen. I remember that I cut myself and it took a long, long time to heal. So cuts and bruises seem to take a lot longer to heal. Tingliness in your hands and feet, fingers or feet. And recurring skin, gum, or bladder infections. These are some of the warning signs that we will see. But the reality of it is a lot of people with type 2 diabetes just don't have any symptoms at all. And they go around with it for years without any symptoms. It does not mean, and you medical folks correct me if I'm wrong, it does not mean that it's still not causing damage just because you don't realize that you have symptoms. It's causing really sincere and difficult type of problems within you. So that's diabetes. I mean, we could go into a lot more about what it is and all the statistics and this and that and the other thing. When we're talking about blood sugar levels, which is really what we're interested in with the diabetic individual, generally it seems that for most people, they want to keep their blood sugar somewhere between 75 and about 120. I would target for myself probably around 100, 105. I feel the best when I'm at that particular blood sugar level. Your physician is the one that would give you the information on you as an individual on what you should keep yours at. But a diabetic has just wild swings on this. It's just it's very difficult to control. We control it through pills on type 2 or through injections on type 1. But you get a burst of it and then it kind of wears off and then you got to give it another burst. There's no like steady way to keep it totally steady all the time. So far. So those are the medical ways that diabetes is handled. What we're here today to discuss, talk about and demonstrate is the non-medical intervention. There is the other side of the coin, as there is with all disease. More and more physicians are realizing there is an important characteristic in healing called the mind. And the mind plays a very important role in an individual. Physicians, to a large degree, do not understand that when a patient is in their office, that person is in hypnosis. The physician needs no formal ritual to put him in hypnosis. When that person goes in the physician's office, they're not going there for a yearly checkup. You physicians in here, I'd like to just, curiosity, give me a guess. What percentage of your annual business is people coming in for an annual checkup? My guess is it's probably fairly small. People see doctors when they have problems, and they're frightened, especially if they're diagnosed with a potentially serious illness. So when they're in the physician's office, they're in hypnosis. What the physician says to that person, how they word, the words they use can be used to cure or to kill. That goes with diabetes or anything else. And I want to emphasize that because some of you are physicians and some of you are hypnosis instructors that will be training physicians. And it's important that you make sure they understand the power of words, the power of semantics. And to show you personally how that can affect a person. In 1988, I had a severe heart attack. And after about 8 hours of balloon angioplasty that didn't work, they were going to do a bypass. And as I said goodbye to my family, and they're wheeling me down to the surgical theater, and I knew the physician that was going to do the surgery, so he was with me, which is about as rare as hen's teeth, and as I was being wheeled to the operating room. I had forgotten everything about my hypnosis training and put my hands totally at the disposal of the physician. And I looked at him, and I said to him, "Bob, am I going to make it?" Here was his chance. Here was the most beautiful opportunity that a physician could ever have. But he blew it. He looked over at me and he said to me, my critical factor was bypassed. I was in very deep trance at that point, at state of waking hypnosis. And he looked at me and said, Jerry, we're going to do the very best we can. Well, my subconscious mind did not accept that in a very favorable way, and I knew I was doomed. My healing process was miserable until I finally went to a friend of mine who was a good hypnotist in Fort Lauderdale that I respect very much, and he removed that suggestion. Had that physician leaned over, smiled at me, and said, Jerry, give me a break. You know, with this operation we do blindfolded. It's a piece of cake. You're going to be fine. You're going to feel better. You'll be out on a golf course in 2 weeks hitting the ball like you never did before. You and I are going to be yucking it up and having a great time. Don't worry about it. Even if I would have died, what am I going to do? Come back and sue him for lying to me? Of course not. So the power of words in any healing is critical. So when you're teaching other people that come to your classes, please emphasize that to them. So let's go into some of the causes that I have discovered seem to be some of the causal factors of diabetes. Now, I have worked probably well over 1,000 diabetics in my career, well over. I'm being a very conservative number because I'm not sure how many it is, but I'm sure it's much more than that. They all have certain characteristics that I've noticed after looking back over my case histories. Certain things that put them into a group that maybe might be something you need to look for and may be able to correct. When we talk about type 1 diabetes, your injector, your insulin injector, I find these mental characteristics within these individuals. One, a deep longing within the individual for what might have been in their life. They are regretting decisions and they are unhappy. They've made mistakes and they feel very sad inside of them. They have tremendous subconscious feelings of very deep sorrow. There is absolutely no sweetness left in their life. Subconsciously, they're very, very unhappy people. Combined with, most of them have a great need to control. They need to be controlling individuals. Now, this is important when we get into the different therapy we're going to talk about. This is a very sad person. This is an unhappy person. Now, consciously, they might be all boobily and bubbly and hail fellow, well met, but subconsciously, they're just very unhappy. Also, some of the things that I've discovered with the type 1 individuals. And again, these are generalizations. You may see one or two of these or all of them, but you're going to see some of them within the individuals. Many, many of them come from a dysfunctional family. Oh, Jerry, what an intelligent thing to say. Why? Well, almost everybody comes from a dysfunctional family in one way or another, you see. Leave It to Beaver is a TV show. Of course, if you're watching this 50 years from now, you won't have a clue who Leave It to Beaver is. Also, for those of you who may be watching this a number of years ago, in the future, I always like to ask a trivia question that, see if you can answer it, based on what's going on today, and this is 1999. Let's see if you can answer this one in about 20 years. What individual in politics said, "I feel your pain"? And write me a letter, but not right away. Let's wait a few years and see if you can remember that one. Another thing we found out is sometimes the diabetes comes on, it's almost as if they're born with it. In these individuals, many, many times we'll see tremendous numbers of them who seem to have and I want to word this correctly because I don't want to put a slant on it, that seem in their minds that their terrible feelings of sadness, their feelings of sorrow, their feelings of need to control have roots in what they perceive to be a previous existence, a past life. Now, like I tell in my regular classes, like I say in my regular classes, your personal beliefs in whether there are past lives or not is not the slightest bit important. What is important, if you want to be a good therapist, if you want to help these people, is you deal with the problem where those folks perceive it to exist. That's what's important. Let the reality of it be in their minds, because it's just as healing if you're working with them in what they perceive to be a previous existence. Never, ever say to somebody in your pre-talk, well, I think your problem is due to a past life problem and we're going to have to go into a past life. Well, come on, you know, that's just not what we do. That's not what we should be doing. Those seem to be general medical reasons that are not non-medical reasons that run through almost every diabetic I've ever worked with, certainly of the type 1 characteristic. Type 2, non-medical, similar feelings, but more emphasis on a couple of other things that might be the difference between somebody being a type 1 and a type 2. They think that they shoulda, woulda, coulda. They should have done this, they could have done that, and again, because of that, we're dealing with deep feelings of unhappiness. Now, that's both personal and professional. They should have married somebody else, they could have married somebody else, but they didn't. They should have become a deep sea diver instead of a hypnotist, but they didn't. Shoulda, woulda, coulda. Also, these individuals, type 2, seem to, in general, have extreme difficulty in the delegation of authority to somebody else. They just don't, it's not even that they don't trust somebody to do it. Well, maybe it is that, but they just can't delegate. Again, it goes back to the need to be in control that we're talking with the type 1. They just don't want to release anything. Their philosophy is, if you want to do it right, you got to do it yourself. It's a trap we all can get caught in if we're not careful. Another thing is tremendous deep sorrow within the individual that's not been dealt with based on the loss of somebody very, very close and dear to them. Or a love that's been lost. Any of you ever been in love? Any of you been in love more than 80 times? But there is those certain loves. It's not the routine love. Maybe some of you have been fortunate enough in your life to be in real 100% love, where you can't stand the thought of being away from that person. You need to be by their side every moment of every day, and if you're not, your whole life is spent just thinking about them. That depth of love. And then you get dumped because you did something really stupid. And you regret it for the rest of your life. That seems to be a very, very universal characteristic when we're dealing with diabetes. It's I don't want to say universal, but it's certainly very high up in the statistical realm from a hypnosis point of view. In general, for us folks that have that, when we contracted it, and unless we made the necessary changes, basically life has removed all feelings inside of us of real joy, of happiness, of excitement. Life is exciting. And basically these people feel there is no worthwhile future. I will just go from day to day doing the best I can with that day. Now I want to emphasize, this may or very well may not be conscious feelings. As a matter of fact, with diabetics, most of these are subconscious feelings. Consciously, a diabetic, you will see, appears normal, works very hard at appearing together, and looks functional. But inside of them, they have terrible heartbreak and terrible sadness. And that's a tough way to go. That's a tough thing to do. Now, how do we work with this? How do we handle this? What can hypnosis do about it? Well, hypnotic intervention can be probably the most dramatic intervention you can possibly imagine. When I first started to work with diabetics, and I remember the first case that I'm really aware of, was a nurse that came to see me about another problem. And she mentioned she was a diabetic. And so she asked me if I could help her. And I told her honestly, I don't have a clue. I don't know if hypnosis will work or not. Now this is probably about 1972-ish, in that area. But I said, let's take a crack at it and see what we can come up with. So the first thing I did was ask her where her blood sugar level should be. What are the numbers we are, actually she was teaching me at this point about it. And her numbers were up in the 300s. And I really didn't know what to do. She was not an injector, she was a type 2. I didn't have a clue what to do, so I said, well, let me just wing this as I go along. I put her into hypnosis, and I told her that I want her to imagine a thermometer, like a big outdoor thermometer. But the thermometer went from 0 to 500. And that the numbers were her blood sugar numbers. And what number is it at now? And she said 300 and change, whatever her last reading was. So I said, okay. I said, now I want you to just imagine that that number is decreasing. And imagine the hand on that thermometer going down, down, down until the number is at 115. And tonight, when you go to bed, your subconscious mind will do whatever is ever necessary to make your blood sugar, bring your blood sugar level down to that level, and will work throughout the day to maintain that level. And I had taped the session, so I gave her a support tape, told her to listen to it. And she said, after she emerged, she says, do you think this is going to work? What did I say? I said, absolutely. It can't not work. This is just the most easy thing in the world to do. I wasn't about to say, well, you know, I've never done this before. I don't have a clue whether this is going to work or not. She was still in the semi-state of trance after emerging from hypnosis, so I just kept firing those suggestions in. And I said, call me in a couple of days and let me know what's going on. And she did. And her blood levels were maintained between 100 and 120. And I was very impressed over this, considering I was basically blind, crippled, and crazy when it came to what I was doing at that time. So I said, this is interesting. I want to look for the data. And there was none. I figured it was just because I didn't have the resources to find the data. But then I found a little bit of data. And I found a little bit of data after listening to Dave Ellman's hypnosis class. And in the class where he was working with a diabetic. And he gave me the ideas that potentially diabetics are very sad people inside, very controlling people, very tight people, very rigid people. and this is what you need to look for, and this is what you need to correct. So at that point, I took it from that as a beginning because there was no other beginning. There was no place to go. I said, okay, I want to work with this as much as I possibly can because this could be fantastic if it really was a viable way to do this. So I said, well, it seems to me that there's going to be two ways to work with this. And what I did was I took the philosophy, because Dave didn't even approach the diabetic problem in the degree that he approached many of the other problems he worked with. But I remember when he was working with his impotence problems, and I said, well, the impotence therapy sounds like a really good therapy for diabetes. Only you just eliminate the impotence and put the diabetes words in where the impotence would be. And it worked out pretty close to being just about what I expected to be. During the pre-talk interview, and let's go through a session just talking here for a minute. In the pre-talk interview, there are things that I wanted to discover about the individual. First of all, when somebody comes into your office, whether you're a hypnotist or a doctor, and they're new, you don't have a clue about that person. We all give them client history forms that hopefully give us a general overview who the individual is. But we don't know that person. We don't know that person until we start a physical interaction with the individual. We see their body language, we see what type of person we're dealing with. And it worked out to be, it seems as if we could locate at the conscious mind the cause of their deep sorrow or of their need to control. Direct suggestion seemed to be extremely effective for these individuals. Where we failed, where it didn't work very well, and when I say we, I'm saying I, because that's all I can talk from is a position of I, where I failed miserably was when I couldn't seem to find out, by talking to the individual, what was causing their terrible feelings of sadness or terrible needs of control. Well, it didn't take a lot of rocket science at that point to figure out what to do. The logic of the situation simply said, get them into deep hypnosis, regress them back to the cause of their sadness, discover what it is, do the required transformational work to get rid of the anger, the hate, the resentment that's causing that deep sadness. And if you can do that, why, they should respond just as well to direct suggestion as the other people did. Wasn't a brilliant thought. And when I did it, it worked. Oh boy, it worked wonderful. Wonderful. So I said, maybe I'm onto something here. And I was down in Fort Lauderdale and just working quietly in my office down there, and I'm feeling really good about what was going on and what was happening. But it was just part and parcel of a hypnosis practice. You know, we were learning a lot back in those days about a lot of different illnesses and what may be the mental effects in regard to the illness. And diabetes was just one of them. But diabetes just happened to respond so beautifully compared to some of the other problems we were working with, that it got to the point that I wasn't really thinking about diabetes. I don't know if this happens to you in your practices, but when something is working and you just duplicate it, you don't think very much about it anymore. You just assume everyone is doing it. And that's where my assumption was wrong, because come to find out that very few people have worked with diabetics or from the hypnotic approach. Have any of you worked with diabetes in hypnosis? Well, that's about the answer I was getting at the convention. No hands were going up at all. And I said, well, maybe I have something to contribute. Let's throw this out and let's see where it takes us. And that's the point I'm at now. And then I'm going to give you what I do. I'm going to tell you what my success rates seem to be. And I will admit to you up front, it's all anecdotal. There are no standardized tests going on here. It's just clients that come in and work with. What we really need, like so many other things, is some good standardized double-blind tests where we can get the data that will be accepted. Now, us as non-licensed people probably will never be accepted, but maybe we can get some doctors involved that would be very interested in doing this. So I want to go over with you step by step exactly what I do with the people. Now, before we do that, let me tell you about the results that I seem to find. It seems that when I'm dealing with a type 2 diabetic, a person who is on a, let's say, glyubride twice a day, it seems that you can pretty much eliminate the symptoms of diabetes with hypnosis. The blood sugar levels are going to remain in the proper range, and the person doesn't seem to need the drug. Now, for those of you that will go forth and start working with diabetics, type 2 diabetics, you never, ever, ever tell them to not take their medication. Ever don't do that. Get them to work with their physician and see if they can cut it back maybe to 1 pill every day and see how they're doing. But it must be under the physician's guidance. I can't not emphasize that enough. But I have found within myself, as a diagnosed type 2 diabetic, by using simple self-hypnosis techniques on myself, that I am free of medication, and I don't exercise or diet. I'm ashamed to admit that to you. But I kill for a filet mignon, you know, it's just one of those things in life. And that apple cobbler I had last night was unbelievable. And yet I keep my sugar range through using hypnotic techniques perfect. Other people who I have worked with, other people that I have taught the techniques to, have similar reported outcomes to me. So it's my opinion, based on the people I've worked with and based on myself, it seems to be that you are able to control type 2 diabetes by using hypnosis, and in a large amount of time have the people become not dependent on their diabetes pill every day. I think that's pretty exciting. I know I'm excited about it for me. When you're a diabetic, you always are cognizant. I remember before I started working on myself of that period right before lunchtime maybe when you got really shaky. I don't know if that ever happened to you guys, but it used to happen to me all the time. So one thing I became cognizant about is there are diabetics out there who don't know they're diabetics. And so I always, even though that I know I'm never going to use it, I always carry with me a couple of glucose tablets, just in case. Well, not just in case for me, but certainly just in case somebody else around me also might have a problem. I'm aware these problems are around me all day long, and it's like a little safety thing you keep with you just in case, your safety blanket. I've never had to use them. I've given them to other people, though, and so it worked well. So that seems to be the situation with type 2 diabetes. Type 1. Diabetes, let me back up. Type 2 diabetes is usually extremely effective by using just direct suggestion techniques. I highly recommend with a type 2 diabetic that you just use direct suggestion initially. What do you got to do? You've got to get the person in deep somnambulism. Do not even attempt to work with the people in less than that level of trance. It's unnecessary, and you need that level of trance for this to work as well as it does. You get them in a deep level of trance, You can use a direct drive technique for compounding, which we'll go over again just to review what it is and how it works. And you give them the direct suggestion, and you compound that. And you emerge a person. I like to give a person, most of you know I am not pro tape listening to. I don't like people listening to tapes. Sometimes it gives a subconscious impression that I have to do this by myself and nothing really worked in the office. Diabetes seems to be an exception to that rule. People like and look forward to that boost that they get from that direct suggestions and the compounding. They look forward to it. They know they can do it on their own, but they really like a very short tape. A short tape, for example, should not be any more than about 8 minutes. We're not going to fool around with long stuff. I'll show you how we do that. If it doesn't work, then you do the therapy that would be required for the type 1 diabetic almost all the time. Type 1 diabetics don't seem to respond very well to direct suggestion. What are the results that you get using the therapy I'm going to describe to you with type 1 individuals? Well, this has been one of the more interesting things that I've come across. When you're dealing with children, and I'm talking about you get them when they're maybe just diagnosed, when they're in that 14, 15, 16-year-old realm, 17. And I'm really leery of saying this. I really am very uncomfortable in saying what I'm going to say, because I can see every head out there in the world that's watching this saying, Jerry, you're absolutely insane. Well, that may be true, but it has nothing to do with the therapy we're talking about. But I have seen these young folks be able to get their pancreas activated, doing the job that it needs to do, and in many cases become symptom-free. As a general rule of thumb, the younger you get the person, the more positive your results are going to be. Young people are so much more suggestible. They believe in magic. You remember that song? I believe in magic. I forget the next line, but and it's true. They believe in magic. They believe you have the key. And remember the rule, the powerful, powerful mental law. What the mind expects to happen tends to be realized. And the mental expectancy of healing, of getting better, is an awesome power within all of us. That is the goal of the hypnotherapist. It should be the goal of every person who works with an ill person, irrespective of category of training, to enhance their knowledge, their absolute knowledge that they're going to get better. And it's easier to do this with young people. The older we get, the more analytical we get. The older we get, the more we want to question. The older we get, the more stuck in old, archaic, anachronistic belief systems we have and we refuse to release. And we're stuck. So, when you work with young people, the therapeutical outcome is very, very good, very, very high. When you get into the older people, things become a little bit more difficult. Again, even with the type 1 diabetes, many times young people will respond to direct suggestion. But the older we get, then we're going to have to take a different approach on it. As you go through life, what sucks the sweetness? What sucks the life out of you? What takes you down so deep your socks look up? What hurts you in the very core of your being, the core of your heart? What makes you angry? What makes you sour? what makes you think life no longer has value and joy? I'll tell you what it is. It's the people you come up against in life. It's the people that tell you what you can't do. Gee, I wonder how many of them are out there. It's the people that have used you. It's the people that have abused you. It's the people who have caused you deep hurt and deep sorrow. So you see, it's a matter of age. When you're young, you're just not in the program long enough to have the build-up that somebody 50 years old would have. So now, instead of doing direct suggestion in general, which we can get away with, generally with folks under the age of 20, now we've got to go in, we've got to open the wound, we've got to kill the infection, we've got to cauterize it, we've got to stitch it up, and then we can talk to it. Now, if you're able to do this, magical things can happen again. All the time? No, nothing is all the time. But many, many times, you can find the injector at least go to a type 2 level where all they need is a pill every day. So let's start with the different therapies. Let's go take this step by step. Let's look at first the direct suggestion approach in handling this horrible problem. First, you do your pre-talk. You eliminate fear and misconception. With children, that's very brief. You probably don't, the younger they get to an age, they don't even need a pre-talk. They're not afraid of hypnosis. Remember, there's no such thing as a good hypnotic subject or a bad hypnotic subject. That's old, anachronistic, tired, worn-out philosophy. The reality of it is, and you've heard me say this over and over again, people accept hypnosis in direct relationship to the amount of what? Fear. Fear that they have of the state. Eliminate fear, everybody is a great hypnotic subject. Now that doesn't mean necessarily fear of hypnosis. It can be fear of what they discover about themselves when they're in trance. Could be fear of hypnosis, but it could be fear of anything. So you got to get rid of fear. You do a good pre-talk. We'll talk more about this aspect of type or non-direct suggestion approach in a few minutes. So we'll do a good pre-talk. Then we need to do the trance induction. We'll do a trance induction that gets them down into somnambulism. Of course, you know, my favorite in that area is probably the Elman induction because of the awesome compounding and fractionization that's built into it, but it doesn't matter. Whatever induction you feel comfortable with, as long as it gets them there. But you got to make sure they're there. Don't say, well, they look like a lump in my chair, so they must be there. Do the testing. Find out. Then once they're there, then you can go ahead, and what I like to do is similar, you know, I like to structure this direct suggestion session are pretty much similar to me. All of mine are about the same, irrespective of the subject. Oh, I might change the pre-talk a little bit, but the session is basically the same. The next thing I want to do, the first thing I want to do, is after they're in deep somnambulism, I will blither with them for just a few moments. Do you know the difference between blithering and blathering? They taught you that in medical school, didn't they? I'm shocked. You blither to an individual, you blather to a group, you see. Whereas you're just talking, you're not really saying anything, just to allow them a few moments to stabilize at that level of trance, get comfortable, and then you go for it. Now here we're going to get involved with the law of compounding. If you're one of my formal students, you know what we're going to do here. But it doesn't hurt to review this and to pound this into the synapses of your mind. The law of compounding simply says, when you give a suggestion to an individual, and when do you start giving a suggestion for therapeutical change? Well, after your induction, after your deepening, after your moment or two of blithering, now you're ready to go. And my first one is always the same. It's what I want them to do throughout the entire session, and that is, all right, now we're going to begin to work together to give you the change you're in the office for. So from this moment on, Just allow every gentle breath you exhale to take you more deeply relaxed. Okay, number one is always the deepening suggestion, but it's weak. It's pretty much meaningless at this point. The second suggestion is always a suggestion worded that they have already accomplished what they have come into my office for. My blood sugar levels will remain at always the proper level that's healthy for me. That's weak. That's not going to happen. But what happens is it makes the number one suggestion stronger. The next suggestion, 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 no matter what it is, always first go back and make the number one stronger, then the number two stronger, then the number three stronger, on and on, up to suggestion 387, or whatever it is you give in your session. That's the basic law of compounding. Now, what I say to a person, though, anybody good at math in here? We have a mathologist. She's pointing at you. Well, I'm not. Hypnotists generally are not math-oriented. Some of us, like me, can't count very well at all. But anyway, there's some kind of a formula involved in this, and I'll tell a person, now we're going to use a direct drive technique. A direct drive technique to saturate every part of your mind, your body, and your spirit with the absolute knowledge that from this moment on, your blood sugar will always remain in a proper and healthy level for you. So, I'm going to give you a suggestion. I'm going to repeat it. And I want you to shout it out with me. I want you to scream it out with me. I want you to shout it out with all the energy of your mind, body, and spirit silently in your mind. And don't be afraid to use pauses. Pauses are extremely effective. My blood sugar will remain proper and healthy at all times. Again, my blood sugar will remain proper, healthy at all times. Again, 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 again. At least 15 times. I don't know what the mathematical formula would be to what power that this particular suggestion is getting, because you're compounding a compound, a compound, a compound of the same suggestion. So it's got to be awesomely powerful at this particular point. But, like the law of compounding is extremely powerful, and there's only one real problem with this. Anybody know what the problem is? Huh?
Getting bored.
Getting bored leads to you not doing it. In other words, you won't do it. Because after about the fourth time, you start to sound very stupid to yourself. Andy says, yeah, I felt stupid to myself once in a while. Yeah, I mean, it really does. No matter how long you've been in the work, when you start doing this, you sound ridiculous. So you cut it back. You don't do it 15, you do it 10. You don't do it 10, you're doing it 7. And finally, it's down to the point where your outcome is miserable. It's just not happening anymore. So what do? How do you get past this? Been here before, haven't you? Sure. You make up an audio tape. I used to have an endless loop tape. You buy them at Radio Shack or something like that. Mine was 30 seconds long. And I would record the suggestion on the tape. And I would then say to the person, you know, as many times it was fit on 30 seconds, then I'd simply say to the person, now, we're going to use a direct drive technique to saturate every part of your mind, body, and spirit. And I want you to shout it out with me. I want you to scream it out with me, silently in your mind, so it penetrates every part of your mind, your body, your spirit. So I want you to shout it out with me silently in your mind. Now this works much better if I leave the room for a few moments. All right, let's begin. My blood sugar levels will always be proper and right at all times. Boom, I'll hit the play button on the recorder. And it'll start. Again, my blood sugar levels will be proper and perfect at all times. I'll say, now shout it out. It'll come on again, I'll go, shout it out. And then I'll say, I'll be right back, and you even shout it out more. Feel it through every part of you, and I'll leave the room. I don't like to go far, though. I like to kind of stay by the door. Because what happens as within every direct drive technique that you do this way, you're giving them a suggestion, one, that they really, really want, and two, that they're getting emotionally involved in. And they're screaming it out silently in their mind, and you're waiting outside the door, and many, many times, they will forget something. And what they forget is the word silently. And then all of a sudden, out of nowhere, you hear this voice screaming, my blood sugar levels are always going to be in the perfect range, or whatever it is. And you're out there going, yes! And it's great because you get excited over this because you know it's penetrating, you know it's working, you know you're getting response out of these people. Then you walk in, hit the pause button, or one of them that don't make a click, I like the pause button, and all of a sudden it's silent. And you say, in a very quiet voice, and it's true, your blood sugar levels will always remain in that perfect range that's right and proper for you. You notice I'm not giving a number. If I give a number, I am violating the Medical Practices Act. You can give a number, you can give a number, I can't. So I figure this is better anyway, that's right and perfect for you, for your best health. And they love it. And then all of a sudden now, they've just been through an emotional roller coaster. Now you let them rest. Deepen them a little bit. Say, now just relax. Just let yourself go much more deeply relaxed. Take a moment to yourself. Well, they're taking a moment for themselves. You are looking for your outline. No, you are looking for your diabetes pattern. Now you've got a great diabetes pattern that I've worked on over the years, and I think it's a pretty good one. It seems to work really good for me. Want it? How about you out there? You want one too? Look in the back of your tape box. It'll be there. What do you do when you do a pattern? How do you read a pattern? That's the next thing. Well, if you just go through and read the pattern, no matter how good the pattern is, it's going to be weak. So every, and this is just standard pattern reading information, every paragraph has a key sentence. Remember we went over this for those of you who took my class. Just as apropos here. You take the key sentence out of every paragraph. I personally used to type them up on a separate piece of paper and photocopy them. And I'd keep them in my, in this case, my diabetes file. I'd have my original of this one, of each sentence, and I'd photocopy it for each session. Then I would go in and you read them the pattern in that very special way that we know how to read pattern, with feeling in our voice, with emotion in our voice. Then we go back, we set that aside, and we take our sheet that has the sentences on it. And you remember, this is the law of compounding. Now you read them each sentence. Every third one you cross off. You go back and read them again. Every third one you cross off until you're down to one or two, and then you read them that, and you're done with your direct your pattern reading. You don't read pattern like this. There is a natural healing power in each one of us, and when we are ready to make changes in our lives, we attract that which we need to help us. That's not how you read pattern. I get tapes all the time from people say, critique my tape, and this is what I hear. So you read pattern. I won't read you the pattern, but I'm going to tell you how to read it. The way you talk to a person in hypnosis is the way you used to talk to your best friend when you were 13 or 14 or 15, and he or she got dumped, and you were up in your bedroom and you were consoling her or him. That's how you talk to somebody. You talk to them from the heart. You talk with feeling. Why? What part of the mind are we talking to? We're talking to the feeling level mind, to the organic computer combined with it. And the way you override an existing suggestion is to give it a new suggestion that is more powerful and has more energy. So that's why we use feeling. All right, everybody, at the count of 3, I want you to shout out, what is the second class you should take after your hypnosis training if you want to be a great hypnotist? 1, 2, 3.
Public speaking.
Wrong.
Acting.
Thank you. An acting class. Because the more of an actor you are in your office, the more you can project, the better therapist you're going to be. Public speaking. You go to public speaking classes, it's really difficult to get over the fear of public speaking. You go to an acting class and say, this is just a role, I'm going to go out there and act, and it's a piece of cake. It's easy to do, you see. So deliver your patter that way, and you will have an excited individual. What's the next step we do? Anybody remember after you read the patter? Remember, the law in a direct suggestion session is one word that separates great direct suggestion hypnotists from mediocre or poor ones. And that law, that word, is simply what? Compounding of suggestion. And we do not miss any opportunity to do that. So bingo, here we go again. Now you've finished your direct drive technique. You've finished your patter reading. You've compounded your patter with your individual sentences. Now you go into your pre-emerging summation, where now you're like a sports coach telling them you can do it. It's like before they run out on the field. Any of you folks ever been in a boys' locker room while they were getting that? You've been out there, haven't you? In the boys' locker room before the game?
Only in my dreams.
Only in her dreams. Where the coach is going, you can do it, you're the strongest, you're the best. You know something about her we don't know? Okay. And you really build them up. Yes, you have been labeled a diabetic in the past, but you no longer choose to wear that label. You choose to be free of that label. From this moment on, you're going to discover your blood sugar levels are going to be perfect, exactly at the most healthy level for you at any given moment of any given day. By God, you are in charge of your body. You are in charge of how your body responds. You've allowed other people to take away your ability to control your own physical being. You're not here because you're a diabetic. You're not here because your blood sugars are out of whack. That's only a conscious perception why you're here. The real reason you're here is because you've made a decision. And that decision is not to adjust your blood sugar levels. That decision is not to get off of an insulin injection. That's your symptom. You're here because you made a decision to take back control of a part of your life that's been causing you severe physical problems, to take back control of a part of your life that caused you to feel sad, caused you to feel down, to take back a control of part of your life that caused all these things, and to move forward with joy in your heart, with a sweetness about life, and every day is sunny and bright. Let's make an understanding here. And I love these pauses, and they love these pauses. No one has the right to control you. Not your mother, not your father, not your husband, not your wife, not your priest, not your rabbi, not your doctor, not the Indian chief. Nobody does. That right was given by God to you and you alone. And you're merely taking back control. And nobody can take that away from you again. And you choose no longer to wear that label diabetic. You choose no longer to allow your blood sugar levels to go outside of a range that's perfect and healthy for you. You choose to look at every day with an excitement and a joy in your heart that is going to be the most fantastic day in your life. Not only that, you're going to discover something else becomes very important to you. And that something else is now you choose no longer to associate in this world with those people who would drag you down, that would suck away your life energy, who will give you negative suggestions. You're going to move away from them like Grant took Richmond. Grant took Richmond? Oh well, you get the idea. Tomorrow morning when you wake up, you're going to know what you have to do to move those type of people out of your life. See, I'm not telling them to divorce their spouse, kill their boss. I'm not saying that. I'm saying their subconscious mind will give them the information that they need to divest themselves from these negative entities in their world. And they'll make their own decisions about that. And I'll finish it up with just rousing, you can do it, TEAM, yay team stuff, by God, you're back in control. Then I'll say, now in a moment, I'm going to count to 3. At the count of 3, your eyes are going to open, you're going to become fully alert, and when they open, you're going to realize you're back in control of your life, you're back in control of your blood sugar. You choose to have joy and sweetness in your heart from every day from this day forward. Now they think they're going to be emerged, don't they? Well, they are, but we still got a few goodies left in the goodie basket. So we emerge them. And we emerge them not, okay, at the count of 3, open your eyes. 1, 2, 3, open your eyes. How do you feel? Not good? Gee, I'm sorry about that. No, you get in there. You get in there, you go, all right, 1, now. At the count of 1, feel yourself coming back up as a new, wonderful feeling of being back in control just goes through every muscle and fiber of your body. At the count of 2, just feel your blood changing already as we talk. Feel it becoming clean and pure and filtered. Feel the sugar levels already beginning to change inside of every part of you, inside of every cell, inside of every artery, inside of every vein. As it courses through your body, feel it healing and healing you. On the next count, your eyes are going to open, fully alert, and you're going to feel better, more positive about your direction in life than you've had for a long, long time. Get ready now. All right? Number 3, open your eyes. And they open their eyes. And what do they think? They think we're done. Are we done? Ooh, no, we're not done. Remember, when a person emerges from hypnosis, depending on the level of trance they're in, you got anywhere from 30 to 90 seconds here to work with a person still in a hyper state of suggestibility. So now you do your post-hypnotic interview. The post-hypnotic interview is the most overlooked part of hypnosis sessions, and in many ways it's one of the most important parts of your hypnosis session. And you simply go up to the person, 1, 2, 3, eyes open, fully alert, and you lean over and you say, look at me right here. You know you've made the decision to take back control of your life. You know that through every part of your body, your blood is becoming more pure. Your balances are becoming in perfect, your levels are becoming in perfect balance. You've taken charge of this. No longer are we going to look at other people to take charge of this for us. We take the responsibility, and you can do this. You're going to find that you're back in control of your blood. You're back in control of your life. Every day is going to be joy. Every day you're going to feel better than the day before, more alive, more excited. And you're going to be just fine. True or false?
True.
Absolutely. Now you throw them out after you take their money. Don't forget to take their money. Now the person goes through home. Generally the feeling they have after a session like this is exhaustion. You're not going to see somebody boinging out of your chair like the Easter Bunny. No, they're going to go home and they're going to rest. And by the next day, they're going to feel fantastic. They're going to feel very, very up, which is what your goal is. Your goal is to reestablish feelings of sweetness, joy, and happiness within the individual. Part of the pattern that I like the best says, and this is something that should be compounded, and you're all going to get a copy of this. It says, from this time forward, I strongly suggest you cease talking about your condition or even giving it a name. The only way it draws life is from your attention and fear of it. And you see that throughout illness. You will see people, seems like the older we get, the more we do this. Sit down and talk about their illnesses. You ever been to one of these parties where everybody says, you think you got a scar? Let me show you this one. Oh, that ain't nothing. I got 8 of them over here. Let me show you mine. I mean, I get up, I run like a deer. I don't want to be around this. You don't give it a name. You don't talk about it. As soon as you say to yourself, I'm a diabetic, you are. You don't have to say it to know what you are. You know that at a certain point you got to take your medication. That's fine. I'm taking this medication because of the doctor. I'm doing him a favor. I'm doing her a favor. Don't want to break her heart. I'll take it. I don't need it, but I'll take it anyway. Don't give it a name. Don't give it energy. Don't let it drain you. That's very important. All right, so that's your direct suggestion type of thing. Now what are we going to do, though, if we don't know the cause? Well, again, it's very simple. It's very like just like the impotence program. Now we're going to do the regression. Before we do that, during the pre-talk, what we want to do, and we can do this very quickly, is find out what kind of a person we got in front of us. A general overview. Who are you? Where did you grow up? Are you married? Are you divorced? Did you go to high school? Did you graduate? Did you go to college? Did you graduate? Did you drop out? Do you like your job? Have you been fired? You want to know about any business failures. You want to know just what is in my chair. And very quickly you can find out what kind of a person you are having there. When you're talking about uncovering techniques with an individual, which is what a pre-talk should be geared to. All right, let's back it up. Let's go back to Hypnosis 101. And remember what we taught in Hypnosis 101. There is only one person in charge of a hypnosis program, the hypnotist. Don't ever let your client do it. Why was Dave Ellman so successful? And he only taught physicians. And his philosophy for a physician to use hypnosis as a practical tool, they must be able to hypnotize that individual and do the necessary correction within the same amount of time as they would allocate to any other patient who would come in for any other purpose. So to use that old expression, it's got to be kind of, in his technique, wham bam, you know what kind of hypnosis. And that's what we want to do. We want to find out who the person is. Very quickly, we want to watch them. We keep our eye on them. We never take our eye off of them. When you're working with a person, this will be uncomfortable for you in the beginning, but fight it and do it. Look at them in the eye the whole time. They're going to become very uncomfortable when you do this. But keep it up, keep it up, keep it up until finally you'll see the eyes kind of glass over, become very passive, and now they're in a deep state of waking hypnotic trance. Now you really can start the program before you even do the hypnosis. When you're doing the pre-talk, you want to find out, you want to uncover what their feeling is. You want to know if there was anybody dead that's very close to them, that maybe that they never had a chance to say, I love you, or I hate you, or thank you, or I wish you would have been dead a long time ago. There's uncovered, unresolved things. You want to see if there's any anger going on. Make a note of what you were talking about if there was anger going on. You want to see if they're crying, because people will break out in tears. What are they crying about? Make a note of what they were crying about. Divorce. Divorce leads to terrible feelings of guilt and sadness. You want to know if they had any business failures. You want to know how many lost loves they've had. not affairs, loves. There's a significant subconscious difference. You want to find out, if you can very quickly, what's their relationship with alcohol. Most people don't think they have a problem with alcohol because they only have one drink a day, and it's in a Slurpee cup, about 97 ounces before they go to bed at night. So you want to see if you can find that out. Alcoholics always have the same thing, the same problem. Absolutely low self-esteem, low self-worth. That's why they're alcoholics. You want to find that out. Because certainly if somebody's an alcoholic, it's going to tell you there's no sweetness, joy, or happiness in their life. You want to find out if they had any periods of promiscuous behavior. Now, we're not talking about a brief fling. We're not talking about the period of promiscuity one might have after the ending of a marriage, after a divorce. I'm talking a prolonged period of promiscuity. If you find that, especially in a woman, well, men don't think they're promiscuous no matter what, but women will, and that you can always bet if they have a long period of promiscuity that you're going to be dealing with sexual abuse. That takes the sweetness, that takes the joy out of life. You're looking for the keys here. And one of the great causes within women is if you can possibly find out if they've had an abortion, or 2 or 3 or 4. Abortion has a terrible subconscious effect on the subconscious mind, and it has to be cleaned up, and it can be cleaned up very easy. One of the ways that you can do hypnosis to find out how a person feels is by doing stems work. Stems is a very powerful way to find out feelings. Let me get this in your hands real quick. Some of you have seen this before, but we will do the review on this. The lady in red. Now, stems is an old Gestalt technique, and it works very simple. We won't go into it in detail here because it's pretty self-explanatory. What you want to find out is how that person is feeling. So you simply lean them back in a chair, close their eyes, and say, I'm going to give you a sentence. End it for me. Say what I say and then put an ending on it. For example, I feel safe when. Well, the person is going to say, I feel safe when I'm home alone. Well, they're talking to you with their conscious mind. Totally ignore that. Just say it again and change the ending. I feel safe when I'm home alone in my bedroom. Say it again, change the ending. Say it again, change the ending. Until finally they've got to answer you from their subconscious mind. And all of a sudden it'll break. All right, I feel safe when I'm home under my bed and nobody's looking at me. Is that good enough for you? Well, thank you very much. I appreciate that, you see. So as you go through each one of these, you want to write one word down on the side. And that is the emotion that you're getting. In other words, if I ever lose control, I'd feel confused, scared. If I ever really let go, I'd feel frightened. I should be stronger because everybody's counting on me. How's that make you feel? Upset. Until you go down the whole list. And you can ask them questions when you're doing this. If I ever let my anger out, I'd kill somebody, or I'd kill him. Ask them, who would you kill? My husband. How's he make you feel? I just want to angry. So you write down it, you look for that one word, a feeling level word, as you go down through here. I like the last one I give them because this can be a roller coaster. Simply says, when I grow up. And then they kind of relax, you know, and they say, what do you think most people say to that? There used to be a song for some cereal company. No, for a toy store. I don't want to grow up. Toys for us kids or something. They don't want to grow up. They'll say, I don't want to grow up. No fun in that. And that's the key. You hear what they'll say? Why don't you want to grow up? Because there's no fun. Now you know you're dealing again with a very sad and hurt person. Now once you get the feeling level mind, now you know everything you need to do the regression. Regressions are easy. Very easy. Is there people here that don't use regressions in your work at this point? Okay. then you know how easy it is. You simply can say to them, there's a feeling you have about yourself, and go down your list. A feeling of being down, depressed, sad, feelings of hopelessness. All your life, you try to keep those under control, to repress those feelings. But this time, I want you to let them up. I want you to feel them. So I'm going to count from 1 to 10. By the time I reach the count of 10, I really want you to feel these feelings very strong and very powerfully. Here we go. 1. I like to tap. Can I borrow your head?
Oh, I guess so.
Thank you. I'll go 1. Now let those feelings come into play. You're feeling down, depressed, sad. 2, 3, 4, and 5. Just sadder and sadder, like a floodgate of emotions going across your mind and body. 6 and 7, like a volcano of sadness. You feel so bad, so down. 8, 9, 10. There we go. Now really feel it. And you'll see people, oh, the tears will be coming down and they feel so bad. And you'll say, wonderful. Now I'm going to count from 1 to 3. At the count of 3, I'll tap you on the forehead. And we're going to get one word. We'll get it letter by letter. That's the real cause of these feelings of sadness. Here we go. 1, 2, 3. The first letter, D. E. Next one, A, T, H. Death. Great. Now I'm going to tap you on the head and count to 3 again. You're going to use this word in a sentence or phrase to describe your real feelings. Here we go. 1, 2, 3. I'm dying, I'm dying, I'm dying. Wonderful. As I count from 10 backwards to 1, we're going back to a time that has to do with death or dying. Here we go. 10, 9, 8, drifting back. 7, 6, and 5, further and further back. Maybe your arms and legs are becoming small. Maybe you're becoming a little boy again. 4, 3, 2, 1. Where you are now, inside or outside, alone, somebody with you. Give me a report. Tell me what's going on. How old are you? And now you will have them back at the point, and you will discover the initial reason of why they feel so bad about themselves. Now, once you discover that, when a person feels bad about themselves, it is almost universally caused by somebody else initially. Initially. When a person gives you a waking hypnotic suggestion through a statement, when you are helpless to resist it, it goes in. But then the second mental law, most powerful mental law, comes into play, and that is simply what you say to yourself about yourself in your own mind is what you become. So once the suggestion goes in there, I'm no good, I'm worthless, I'm a bum, your father said that to you when you didn't even have a critical factor formed at that point, then you start saying it to yourself, I'm a bum, I'm no good, Daddy said so, and it goes in because there's nothing to block that. So not only can you get these implantations from other people, you get it from yourself, from you to you with love. And that's terrible to do that. So now you've got to clean it up. The goal is to, 1, find out who are the people, the event, and then who the people are that caused the problem for you, that caused the feelings of sadness. 2, to get the individual to forgive those people, which is extremely the most difficult part. For without forgiveness, there is no change. I don't care what you do, it won't happen. In these situations, I don't care what drug you give the person, it'll cover the problem. For those of you who took my regular class, we heard a tape called The Story of Jane, where in one session we helped this woman who was classified herself as insane, checked herself into a mental hospital. And after one session, after doing the forgiveness, she was totally better. And she came back for her second session. How did it happen so fast? And she mentioned it was the forgiveness. And you hear her voice. She says, it was the forgiveness. She said, but was I really forgiving? Then she said, then I knew I was, because of the wonderful feeling I had inside of me when I forgave. So what you do, and this can be very easy, is you pick the biggest rat exposed. The biggest person that hurt them in their life. And using whatever technique that you were trained in your earlier classes to obtain forgiveness. I like chair therapy or deathbed therapy personally, because it's quick and it's effective. But whatever technique you may have learned, to get them to forgive the most terrible person in their life. Now, if they do this, then the enormous feeling of pleasure that they get out of forgiving that person. And for those of you who have never forgiven somebody, you couldn't comprehend what I'm talking about. The first time I did it was after my heart attack, and I realized I had anger. And I didn't even know who. I found out who it was, and I thought to myself when that happened, I can't forgive that person for what he did. But then when Ellis Rayburn gave me the reasons why it was in my best interest to forgive, I did it. And it was like a rubber band snapping, and all of a sudden I was light, I was free, I was giggling, I was happy. And then there were other people in line, not as bad, but other ones in line. And he simply used a technique that I teach in my classes. I'm going to give you a period of silence. Your subconscious will reveal to you any names of individuals in the past who have ever hurt you in any way. And when you're aware of them, forgive them and set them free. And I was so eager to do that based on the feelings that I got off of that first one. The rest of them fell like dominoes. And each time it was a snap and this absolute feeling of like helium inside of you. And you felt so excited and you felt so good. And once you get that done, then you're ready. You're ready to do the direct drive technique, just like you do in a direct suggestion technique. Do your direct drive, do your patter, and you are going to have the same outstanding results that you would have if you were just doing the direct drive or the direct suggestion technique on a young person. I cannot tell you how powerfully effective this is. Is it simple? Technically, it's simple. Where's the hard? Where's the difficulty coming here? The difficulty is very easy to isolate and to point the finger at. There's certain areas you need to be very, very cognizant of. One, somnambulism is everything. In our coma class this afternoon, when we talk about levels of trance and what the different levels of trance are and what they're good for, somnambulism wins heads down. So you got to have that, especially when it comes to forgiveness. People don't forgive unless they're in this nice deep level of trance. That's when they feel a snap. That's when they feel that rubber band break. So if you don't know how to do that, you folks out there watching this tape at home, go to somebody who can teach you how to get the somnambulism. It used to be a technique that was difficult. Now everybody's teaching it. Everybody can show you how to do it. Please learn that, because that's what's going to make you a fantastic hypnotist. So that's your first area of concern, is making sure you have the correct level of trance. Now we're talking about the regression work. The second area of concern is obtaining the forgiveness. And this is tough. Now, when you regress a person and you get them into this situation, sometimes it can be pretty traumatic. Sometimes it can be very emotional. Your job is not to keep them there. Regression, if it happens to go into an abreaction, is only good for two things. One, who are the players and what happened, and get out of there as fast as possible. Getting the forgiveness is 100% or 99% of this therapy if you're going to make it work. That means you must, depending on you'll see the individual, you'll sense whether they're tense, whether they're really doing this or not. If they say to you, okay, now, would you be willing to forgive? Yes. So, well, let's take it through. How do you get somebody to forgive somebody? You've identified the person. In our case, we would do chair therapy where we would have them argue back and forth, pretend they're each person, get out all the negative energy until they're finally talking to each other. Then we'd have the villain ask for forgiveness. And we simply, now what we don't want to do at that point is say, okay, this person asked for forgiveness. Will you do it? Not yet. No. This is the most critical part of not only a session for diabetes, but for any kind of a session that requires dealing with somebody who's hurt us for some reason. You got to give a person a reason to forgive somebody. If they have no reason, they don't see the value in it. So I tell them certain things. I say, look, if you don't forgive this person, it doesn't bother them. They go through their life, no big deal. It only holds you back. It only causes you pain and suffering. And when you forgive somebody, and this is important, you tell them, I'm not asking you to like that person. They did you wrong. You don't have to like them. I'm not asking you to condone the behavior that they did. They were wrong. All I'm asking you is to understand that their programming, that in many cases they couldn't even avoid getting, brought them to that point that they responded that way to you. And if you choose not to do it, you're not going to have any healing, and they're going to continue to control you for the rest of your life. And you got to keep talking until you see finally, you'll see in actually a kind of tense person when you talk about forgiveness, and then when they've made the decision to do it, you'll see more of a sinking back, you'll see a releasing of the shoulders, you'll see kind of a smoothness come to the face as the tightness of the fear of forgiving or the anger kind of goes away, where they become reconciled to the concept. That's when you say, and watch them close for this, now, knowing what you need to do, now, do you have the willingness to forgive this person and set yourself free? At that point, you become extremely professional. What I do is I cross the fingers of each hand, I cross my legs, I cross my eyes, I cross everything, because the entire session is dependent on what this person says next. If the person says to me, no, I can't forgive this, and believe me, if you don't like foul language, stay out of hypnosis. You'll see the cutest little old ladies just nailing you to the cross. Anyway, if they say no, I say, okay, at the count of 3, eyes open, fully alert. Or I'll talk to them a little bit more and see if I can talk them into it. But if I can't, I emerge them, I send them home. I can't help them, period. It's the end of the road. There's nothing I can do for the people. Now, the problem is that there's a certain percentage of the people you're going to work with that are going to be this way. That they would much rather hang on to the anger, hate, and resentment than to release that turkey and get on with their life. And this is what makes you feel bad. Makes you just so angry. Well, you got to fight that. But it makes you so hurt because you say to yourself, I should have done more. No, you did all you could if you've done it. And there's certain people that are just going to make this decision, and there's not much you're going to do about it. But this is where you got to put your emphasis. This is where you got to put your power. Now, if you're able to do this with a diabetic, there's something happens when a diabetic forgives these people, because I'll guarantee a diabetic has a lot of forgiveness that's got to be done. When you take all the sweetness out of life, all the joy out of your life, somebody took it from you, they're going to have to be dealt with. And when they deal with them, it's almost there's an imaginary, not an imaginary, there's an invisible energy that you will feel transmitting between the two of you that says, I understand, and I understand what the results of my thought processes have done to me. You'll see this with diabetics. You'll see this with people with severe heart disease. They've got tremendous anger inside of them. And you will see this, you will feel this understanding, and when they talk to you from that point on, even in trance, you will hear a different voice. You will hear a smoother, a less choppy, a more caring, compassionate voice within these individuals as they realize what they've gotten rid of. Then when you do your direct suggestion work, you're going to discover that they accept them very powerfully, because now there's no resistance to accepting the direct suggestion. Can you imagine giving somebody a direct suggestion saying that, oh, everything's going to be fun and la-di-da-di-da-di-da, while they are so angry and so upset inside? How can you just say you're going to have joy and sweetness? How can you say you're just going to be happy? You're going to be happy from now on, and life is going to be goody gumdrops, you see? And it's not going to be there. I'm personally in our profession, our profession is an evolutionary process, like every profession is an evolutionary process. What we know about hypnosis today compared to what we knew about hypnosis 15 years ago is light years. What medicine knows today compared to medicine back in the 1800s, what was the form of therapy back then for about every illness that you remember? What was the big illness? Consumption. Remember that one? How did you treat it? Did you ever do that in your office, treat it in the old way? You cut them open and bleed them. So you see, we've got to move beyond the point of what we used to know and learn new things. And it's the same thing with this. There are too many schools out there, and I'm embarrassed to say this about our profession. Hopefully, while some of you are watching, this has changed dramatically, but there's too many schools out there to teach one induction, usually a progressive relaxation induction. They teach you how to read them some patter, or they'll give you some patter to read. They'll teach you how to emerge them and send them home with a tape to listen to. And these are why the reasons it doesn't work. If we're going to be in this business, we need to learn how to push the buttons that we need to do to make the transformation. That's what makes us good. That's why you folks are out here today. And when you're working with the diabetic, I think one of the really nice things I like about working with diabetes is there's certain things in this profession that give you instant gratification. Diabetes is one of them. When you send a person home, maybe you give them a support tape with this patter on it. They like this patter. I'd abbreviate it, get it down so it's less than 10 minutes. You give them that with a real quick fractional relaxation induction. I'll just have them say, now, just get in a nice comfortable position. Take a nice deep breath, exhale, and close your eyes. Now let your mind drift back to how wonderfully relaxed you are mentally and physically in my office. And just instantly now allow yourself to be there again. And as I count from 5 backwards to 1, you'll find that you'll even be able to go more deeply relaxed than you were in my office. And a nice slow count from 5 down to 1, and I am done with that induction. And that whole thing hasn't taken me 30 to 45 seconds. You don't want to waste time with long fractional relaxation inductions. And they have that support tape, and they love the tape because when you get into reading this patter, you're going to see how positive, how exciting it is, how we're basically saying, you know, you're going to take off that old coat you've been wearing that's been made out of lead, that's been dragging you down, and you're going to move forward, and you're going to feel excited about your life again. And when you get people to do this, your instant gratification comes into play. How does it come into play? The next time that person comes in and tells you, my blood sugar levels, I've been testing them 3 times a day, are all within this certain parameter that we said it was going to be at. Or when they come into your office as the physician, and you check their blood sugar levels, and you're looking at it and go, whoa, this is pretty exciting stuff. There's your instant gratification. What are the other things that give you instant gratification that I personally like? Childbirth. Is there anything better than that? You're not dealing with any negativity, no slime, none of the goop that you get from all the other stuff. It's just awesomely fun stuff and tremendously effective. And I put diabetes in the same kind of a category, other than you may have to wade through some of the garbage to get to where you want to be, but the instant gratification is there. And I'm that type of person. I just like instant gratification. I don't like waiting for my goodie, you see. It's like after dinner. As a loyal diabetic, I want a cookie or more, you see. So this is going to work for you. This is going to be a powerful way to deal with diabetes. The patter is excellent. It's evolved over the years. It gets right to the core of where we want that and what we want to attack with the individual. You will find there's not an awful lot in the patter that deals with diabetes, other than we will say, for example, your pancreas is working up to its full efficiency. No longer is it lazy and lethargic. We'll say things like that. My pancreas is going to do what is ever necessary to keep my blood sugar levels at the perfect level for me. But we're mostly hitting on the patter is putting sweetness back into their life, bringing the joy back into their life. Now, if you're able to do that, I truly believe that that alone would probably correct the problem without even mention anything about the pancreas or blood sugar or anything like that, because I think that's just a natural byproduct. All of you who may be diabetics, just go inside yourself for a moment. 'Cause I know I had to face this myself. You know, you can say anything you want to the people in the world around you. But if you go inside your own heart, you close your eyes, and you let your mind drift and say to yourself, am I really feeling the way I want to feel every day? Am I really feeling excited about getting up in the morning? Am I critical of other people? Am I judgmental of other people? Am I happy? My guess is you're going to stumble over that. My guess is if you tell the truth to yourself, you're probably going to find that you need a little work in that area. But I'll tell you one thing. It doesn't have to be that way. I'm a firm believer in medicine, for without it I would have been dead many years ago. But I'm a firm believer that medicine and hypnosis should be a marriage, and the best of both should be what heals the human body. Because if all you do is heal the meat, if the problem is caused by something other than that, it's just going to come back, maybe in a different way. But there's nothing more powerful than the physician and the hypnotherapist working together, or the physician that is trained also in hypnosis. Because when you're in your offices, you don't even have to use an induction. Those people are in hypnosis. Just tell them, now I want you to medically relax. I want to teach you how to do it. Just close your eyes, and I want to teach you how to medically relax. Stay away from the word hypnosis. And you'll knock them so deep they'll think they're in Cleveland. If you're in Cleveland, that doesn't mean you're not here, you know, but I forgot somebody in Cleveland might be watching this. I always get myself in trouble. Anyway, I don't think it's the mistake on the lake they used to call it. It's a beautiful city now. It's changed. So the point is, that's how you do the work. That's the goal you want to do. You strip everything off of this and you say, what do I want to do with a diabetic? I want to create joy in his life. What do I want to do with a diabetic? I want to recreate the sweetness. Think back when you were a kid. Remember when you were a kid? Say this high. I don't know what age it is. I just judge kids by height. And I remember about this high. This is what I call the boinging state. They're boinging all over the place. Everything is exciting. Do you remember those days? I can remember them. You weren't worried about making a living. You weren't worried about whether you were breaking the law. You weren't worried about eating. You weren't worried about anything. You were amazed by a light switch or an empty box or a cloud. Remember when you were a kid, did you ever lay down on the grass and look up at the clouds and were totally amazed? And you started to giggle, and it took you away. Do you remember the joy you had at that time of your life? Well, if you do, you're lucky, because there's some people who never had that. There's some people who were brought up in families that were so horrible, so horrid, they never had that joy. And there's a whole base of diabetics right there, I'm going to tell you right now. So that's the goal. How you get to the goal is basically, one, if you know where the problem, what the cause of the problem was, then you can use just a simple direct suggestion technique with powerful, powerful compounding, direct drive, do it that way, do the post-hypnotic interview, and you're going to have great results with it. Or do the regression, find the cause, do the forgiveness. Standard therapy that will do for a lot of things. Even works better in many cases with this because it's easier. The other thing you can do is modify it based on your own feelings. You come up with your own concepts. That technique I used with that nurse was really kind of neat, where I said, I want you to imagine the outdoor thermometer, only it's not an outdoor thermometer, and it goes from 0, and I said to, I think, 500 or something. I probably should have made it 600 or 700, but maybe I shouldn't have made it 0. You know, it might have been the best thing in the world. your blood sugar level is at 0, what happens? Anybody know? Coma, 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 comedian. Yeah, you're out of here. So, but anyway, that worked really, really well for visual people. You know, can you picture this in your mind? Well, just picture it exactly where you want to be. And tonight as you're sleeping, your subconscious mind will do everything necessary to keep it between. You know, you don't want to just hammer it on one, because we're going to have natural fluctuation, to keep it between these two parameters. And these two parameters will be what the physician recommends the two parameters will be, not what you guess it should be. And you'll find that's a terrific, terrific way to do it. That's it. No secrets, no magical potions. This is just routine hypnotherapy as we do for so many other things. The only difference is the outcome is tremendous. What amazes me is when you see a person who's a type 1, and I'm going to be conservative here, when you see a type 1 go down to a type 2. What is more amazing is when you see a type 1 not even need glyubride. Does that happen often? More often than I care to tell you, because nobody would believe me. I want you to get into the work. I want you to do this work. You will be absolutely mind-boggled on how well this works. Just with I've dealt with diabetics that I didn't have time to work with. I'd go on vacation someplace, and of course they got to tell everybody I'm a hypnotist. Can you help this? Can you help that? And occasionally, I'll edit this out of the tape later. Occasionally, when I was out of town or in New York or upstate New York visiting my mother-in-law or whatever, I might say to somebody, well, here's a tape on diabetes, might make you feel better. And I just had this thing. On the tape, I had to use a short fractional relaxation induction because the people weren't in hypnosis, so I couldn't say, let your mind drift back to what it was. And I had this patter in there, and I can't tell you how many reports from people who said that they don't need the pill anymore. They reported to my mother-in-law, because that's generally her girlfriends or whatever. She was very popular up in the area. And the tape worked fine. On the tape, this doesn't have the visualization with the thermometer, but you could just as easily add that to it. I think I did on the tape that I had made up back in those days. And it was working wonderful for people. Now, you got to go do this. You got to do this because it works. You got to do this because those of you who are diabetics, in my opinion, humble opinion, IMHO, in my humble opinion, I don't think you have to be. I think you can be a non-diabetic. And again, for those of you that are out there at the who may be a person stuck in the old thought process and saying that Jerry Kine is a nut, I respect that, because you have your right to your opinion. And I don't mind you calling me something, but do me this favor. Try this before you do. And then we talk about it. And I think if you do this the way I described it, you're going to have a tremendous, tremendous result on it. Anybody want to talk about this a little bit more? Do you got questions that I maybe can answer for you?
Could you expand a little bit more on that insurance aspect that you talked about before?
Insurance, third-party payments for hypnosis. Okay, as non-licensed hypnotists, of course, we all know we cannot collect insurance. On the other hand, if you are a physician, there is a code for hypnosis. I don't know what it is, but maybe one of the doctors can tell you what the code is. Many hypnotists work with physicians as an adjunct with the physician's work, and the physician puts it through their code and things in that order. That can be worked out. But you can't get third-party payments unless you're licensed. Okay.
Can you work for the diabetes with your ultra high?
Can we? Oh, brother, can we? Yeah, and we're going to address that in another session. She said, can you work with diabetes through the process of ultra height? Unbelievably well. Ultra height, of course, is a whole separate program. It works terrific. And I like it because you don't have to do anything. The client will do it all by himself, yes, but that's a whole different way to approach it. It works great. All right, in a moment, we're going to shut the tape down. And we'll hang around and answer other questions, but we need to shut tape down because we're running out of tape. So thank you for being here for the diabetes, and I hope that those of you who are interested will work with this and see the outcome. You'll be thrilled. Those of you that have diabetes, get with a hypnotist. Get this done to you.